death. But the thing that's really concerning is that the cases are rising, and in younger people, it was very rare to see anybody under the age of 50 being diagnosed with colon cancer. But today, people in their 40s and 30s, even 20s, and I've heard of even cases involving teenagers, are developing colorectal cancer. Is it toxins in the environment? Is it something in our diet? Is it microplastics? Is it inflammation? What is going on? Those who ate the most foods, 45% higher risk of developing precancer in the colon specifically, the kind that's most likely to develop into a full-blown colon cancer. Eat foods that actually improve your intake because feeds those beneficial gut bacteria so you have more protection. What are the foods that can do this? Testing why colon cancer might be showing up earlier in life, we have to start at the beginning of cancer, that is. And colon cancers all start out as abnormal cells, right? So you've got normal cells. We call that normalplasia. Then you get hyperplasia, where the start cells start to go a little bit crazy, and they pile up in each other, and that can be in what we call in the colon an adenoid, like a polyp. So a polyp is just a bunch of cells that are piled up on top of each other until they grow either like a mound or like a mushroom. Colon polyp, you've probably heard about. And then from there, the cells in that abnormal mound or the mushroom can actually mutate. And then that actually turns into full-blown colon cancer. But I want to actually focus a little bit about these early adenomas or colon polyps, right? The polyps are the kind of things that you hear about that a doctor called a gastroenterologist spots during a colonoscopy. In fact, that's what gastroenterologists performing colonoscopy are looking for. They're looking for not colon cancer. They're looking for colon polyps because these are the earliest signs that cancer might develop. So if you can snag the polyp, you can actually be in good shape. Let's talk about colonoscopy. This is the test where a specialist, a gastroenterologist, trained one, actually takes a long, flexible tube, and while you're under sedation, they actually put that tube right up your rectum, and they can actually have a camera at the other end of it, and they can see every aspect of your colon. Now, before you get this test done, you got to do a clean out, as we call it, and that's just taking some pills or some liquids the night before that actually make you basically have diarrhea, and you clear out everything in your bowel. That way, when the gastroenterologist looks in through colonoscopy, everything, it should be squeaky clean. You can see the walls of the colonos very, very, very nicely. Now, what are they looking for? Looking for polyps, right? Polyps are not normal. The normal wall of the colon is smooth and glistening in pink and very, very uniform. In fact, there are kind of little ribs that you can kind of see around the walls of the colon, kind of like a slinky, like a big compressible tube. You pull it out, it stretches out with these rings. That's what the colon kind of looks like. Now a polyp is growing right in the middle of there, popping out towards the center of the colon. So right into the tube, the cavity of the colon. So right into the tube, the cavity of the colon. As I mentioned, they can look like mounds or they can look like mushrooms. Those are all cells that are not normal, and those abnormal cells begin piling on top of each other. All right? And they're sitting inside the colon. These are precancers. They're a sign that cancer might develop. And if you don't do a colonoscopy, they'll sit there possibly for many, many years, and then left alone, they can become inflamed. And some of those inflamed cells, abnormal cells, can go on and mutate and transform into this full-blown dangerous colon cancer. Now, not all the polyps will actually be like that, but some of them could be, and that's really what we're looking for when we actually talk about screening, colonoscopy, to look for hidden dangers that might indicate colon cancer long before a diagnosis of cancer is actually made. We're looking for abnormal growth like adenomas or polyps. They can look like mounds, they can look like mushrooms, and they're very distinct from the normal colon wall. And what happens is that a gastroenterologist will basically put a lasso over the polyp, all right, and squeeze it shut and pull it right out, okay? And squeeze it shut and pull it right out, okay? So you pretty much amputate the polyp and pull it right out, and then that tissue that gets pulled out gets sent to the lab to see, well, is there any cancer cells in there or not? Hopefully not, usually not, but in fact, if there is sort of the beginnings of cancer, then you've actually nipped it in the bud about as early as you can possibly get, right? That's actually how you actually get the best outcomes when it comes to having colon cancer. Early detection, early intervention, much, much better outcomes, right? Okay, now what is the relationship that I want to talk about when it comes to diet and colon cancer? Well, there's a logical connection because, well, the colon is part of our gut, right? So a lot of people don't think about this, but our gut starts from our mouth. That's the first part of the gut, down our throat, down our esophagus. That's also the gut, into our stomach, also the gut, and then goes into the small intestines. Very important part of the gut, all right? Then into the large intestines. That's the tail end of the gut. That's the tailpipe of the gut. And then finally into the rectum, which is a kind of a holding chamber for feces or stool, and then the rectum and the anus. That's where it all comes out at the very end. But that entire shebang is actually your gut. We're talking about colon cancer, which happens in the colon. That's that end big fat tube in the gut. And we're looking for abnormal growths, early stages of adenomas, could be early cancer, and we want to nip those in the butt. All right. Now, the relationship to food makes a lot of sense because when we eat food that we eat goes all the way through the entire digestive system and it winds up in the colon. So the cells of the colon, the lining of the colon, are exposed to whatever it is that we eat, right? Like directly exposed to whatever it is that we. That if what we ate had inflammatory chemicals or anything that might cause mutations or inflammation, well, you can bet that those cells in a polyp are going to actually be exposed to those same chemicals as well, right? So this actually might help you make sense on how food is connected to the health of the lining of your colon and anything that might be growing into it. What kinds of foods might be not so good for colon health? Which kind of foods might be linked to development of polyps or the precancerous stage in the colon that will lead to full-blown cancers if you just let it alone and let it tick away all by itself. Okay, I want to tell you about a study. These are done by researchers from the United States, United Kingdom, Brazil, Korea, and Japan. They were all taking part in a kind of a team, as a team of the Cancer Grand Challenges Prospect Study. And what this study that they did was to look at early stage colon cancer, specifically formation of the polyps. Remember, normal colon, normal cells, abnormal cells go to abnormal cells piling up or thump each other like a mound or a mushroom, and then some of those cells in the mound or mushrooms mutate, and they go into full-blown colon cancer, a period that takes place over the course of years. So this research group studied 30,000 women for more than 24 years. That's a lot of people over a lot of years. And by the way, the women were all part of a big clinical study called the Nurses' Health Study. This is one of those gigantic population-based studies that really tracks health outcomes across a number of different parameters, including cancer, or in this case, precancers. Now, each of the women in this study had undergone 2 or more colonoscopies before they were 50 years old. Right now, 50 used to be the cutoff of when we recommended colonoscopy. Now, it's getting earlier. But in this particular study, the women had had at least 2 early peaks inside their colon to take a look at whether it was healthy or not, right? So this gave the researchers a chance to look for any early growth before the age of 50. Remember, I told you when I went to medical school, we were always taught that colon cancer occurs, older than 50, 60, 70, but very rarely earlier than that. But these women actually had the benefit of having that early look. All right? Now, in their study, the researchers also looked at what these women ate, okay? They had a detailed dietary questionnaire, and one of the things that the researchers focused on was ultra-test foods. Now, you've heard this term many, many times, I'm sure, ultra-test foods, UPFS. These are packaged snacks, ready-to-eat meals. They're foods made with additives, a lot of additives. You look at the ingredient label, there's 20 more ingredients, most of which you can't pronounce. Emulsifiers, stabilizers, artificial preservatives, artificial coloring, artificial flavoring, all right? And so what the researchers wanted to ask is, did the level of consumption of ultra-rosses said foods correlate with developing these early precancerous colon polyps, right? That's the question. Did what you eat can correlate with actually forming precancers? So here's the thing that you need to know. On average, in this 30,000 group of women, the participants were eating ultra-processed foods, all right, like packaged snacks, about 6 servings a day. All right, that's about a third of the daily calories, kind of typical in many places like the United States. And over time, 2,700 of these women developed adenomas. These are the polyps. All right, the abnormal cells that built up. And what they found is that those who ate the most ultra-processed foods, around 10 servings a day, Now imagine that eating 10 servings of packaged foods a day. Those women who ate that many ultra-processed food servings had a 45% higher risk of developing a colon polyp, a precancer in the colon, specifically the kind of polyp that's most likely to develop into a full-blown colon cancer. That's exactly what you don't want. And by the way, the risk climbed higher step by step by step. All right, for every additional serving of ultra-processed food that they were eating, the risk of developing a colon polyp leading to colon cancer went higher. Why is this? I always ask, and you should ask what's going on and what's the reason for this. The why is actually gives you the understanding so that you can take an action. Well, a couple of things that we already know goes on. The chemical ingredients in ultra-processed foods, they're pretty hard on the gut lining, the gut barrier, and when you break open the gut barrier, you're causing basically the stuff inside your colon to leak out into your bodily tissues. Might even be into your bodily tissues. Might even be into your bloodstream. That's highly inflammatory, and inflammation, all right to a cancer. An early cancer is like pouring gasoline onto the embers of a fire. You can be assured that that's actually going to stoke the growth of the cancer. All right, so the chemical ingredients in ultra-processed foods are very irritating and damage the gut lining. Now, the other thing is that many of the chemical ingredients in ultra-processed foods can also affect the gut microbiome. You've also heard often about the gut microbiome. These are the 39 trillion healthy bacteria. They're supposed to be healthy, that form an ecosystem inside your gut, and they're supposed to be happy and composed of normal bacteria, and they're supposed to lower inflammation in the body. The other thing the gut microbiome does is that boosts your immune defenses, which protects you against cancer. So ultra-processed foods increases chronic inflammation, lowers protective immunity, and weakens the wall of the gut so that actually more toxic materials actually can leak out and cause inflammation. Now, this is what happens over time, and it lowers